Hello, my name is Sam Harkis. I'm an audiologist with Australian Hearing, and I'm going to take you through this tympanometry refresher module. I'm going to talk about what tympanometry does, why and how you would use it, and what the results mean. So this module has been designed for health staff, including Aboriginal and Torres Strait Islander health workers who've been trained in tympanometry in the past, and maybe it's been a while since you've used it and you'd like a refresher. It'll take around about 20 to 25 minutes to work through. The slides are automatic and you can press pause as you need, or you can speed up by using the forwards or go backwards by using the backwards arrows. So as an audiologist, I wouldn't, and neither would my colleagues, choose to work without tympanometry. It's just a standard part of what we do in our test battery. But is it useful for primary health staff, and how? This module is in 4 sections. What is tympanometry? Why use it? How to use it? And what do the results mean? This is a really nice quote from a GP who was involved in a study of tympanometry in primary health in Western Sydney. And he said, "If I hadn't done the tympanogram, I might have just said, 'See you later,' you know? It's hard to appreciate middle ear pathology, I think, just from looking." So what is tympanometry? It's basically a way of measuring how the outer and the middle ear is functioning. You do it with a device called a tympanometer, which measures the volume of the ear canal and how flexible the eardrum and the middle ear is. If you combine it with otoscopy, it can help you answer questions like, does this child still have glue ear? What's going on behind that lump of wax? And is this grommet open or blocked? And of course, it then helps you with treatment, management and referral decisions. So why use tympanometry? First of all, you can use it to improve your confidence in understanding what's going on behind the eardrum in the middle ear. Use it when otoscopy gives you only limited information because wax is blocking your view or you've got a narrow or bendy ear canal. You can use it when you reach the limits of what can be achieved with otoscopy alone. So is a grommet open or blocked, and what's happening behind the wax? And use it because a test battery provides greater accuracy than a single measure. This recent study with GPs in urban practices showed that being able to have access to tympanometry results led to changing their diagnoses and management plans. So when wouldn't you use tympanometry? Well, firstly, when the child's ear is discharging. And secondly, if you suspect that a perforation has only recently healed, don't do tympanometry. Right, how to use a tympanometer? It's very easy. Every machine is slightly different, but they all work in similar ways. It's a good idea to practice on yourself or ask someone to come along and practice with you. So what you should do is see if you can find the instructions or, of course, Google them. If all else fails, just switch on the machine and follow the on-screen instructions. Find your ear tips and place them nearby, and find the interpretation guide that came with the machine. But don't worry, if you can't, we've got one on our website that you can just download and print. So when you're using a tympanometer in the appointment, of course, show it and explain it to the child and family. And you can say something like, okay, I'm just going to use this machine to see if we can see how much your eardrum bounces. If the child is old enough, involve them so they can hold the machine and switch it on, and they can put their own ear tip on. You can show them that it's not sharp. So when you're choosing an ear tip, choose one that's small enough that it slightly enters the ear canal, but big enough so that it blocks the whole entrance, so you get a nice air pressure seal. And of course, tell them what you're going to do. Something like, let's just pop this in your ear and see if we can draw a picture. It makes a buzz and some air will go in and out of your ear. Use the buttons on the machine to navigate to the beginning of the test for whichever ear it is you're testing. And to do the test, as for otoscopy, make sure that the child is seated or cuddled securely. pull their pinner up and back firmly to straighten out the ear canal, same as for otoscopy, and imagine or visualise where the eardrum is and point the tympanometer in that general direction. Push it firmly against the child's ear canal opening so you get a pressure seal. Keep your eye on the tympanometer screen. It will tell you when you have an air seal, and once it has an airtight seal, it'll just run the test automatically. If you don't have an air seal, just rotate the tympanometer slowly, aiming to point it better towards the eardrum. Stop rotating it as soon as you do have a seal and keep the tympanometer still. If you don't get a clear result, repeat, and we often do that up to 3 times just to ensure that the results are consistent and repeatable, and then we make an interpretation after that. When you're looking at the results, note the type, which we're going to talk about in a second, and ear canal volume in cubic centimetres, and then move to the other ear. So, what do the results mean? There are 2 key pieces of information to note on the results screen. Firstly, what shape is the trace that you're seeing, and where is it in relation to the box? That's that tall black rectangular box that's in the middle of the screen there. So is there a peak, and does it fall within or outside that box? And the second thing you want to look at is what's the ear canal volume in cubic centimetres? A trace that indicates normal eardrum and middle ear movement is shaped like a mountain, and the peak falls within the box. A trace that indicates negative middle ear air pressure has a peak that falls to the left of the box. And a trace that indicates lack of movement or no movement in the middle ear system is flat. Here's something that's nice to know. The scale along the bottom shows air pressure. It's measured in millimetre H2O or DAPA, depending on your machine. The box, the tall rectangular box, represents the normal range of air pressure from plus 200 to minus 100 DAPA. What's good to know is that for children, a peak that falls a bit to the left of the box, that is up to minus 150 DAPA, can also be taken as a type A. So here is the ear. Obviously it's not to scale. I'm sure you'll recognise the key features. The middle ear should be filled with air, and the air pressure in the middle ear should be the same as the air pressure on the other side of the eardrum, the outside air pressure. You probably remember that air gets into and out of the middle ear via the eustachian tube. So when you do tympanometry, the machine pumps a small amount of air into the ear canal, and then it draws it out again. And it also sends a soft humming sound into the ear, and it measures what bounces back. So the tympanometer puts these pieces of information together, and it works out the ear canal volume and the middle ear movement. So what's ear canal volume? It's the space beyond the tip of the tympanometer. So if the eardrum is whole, so no hole, it's intact, that space will finish at the eardrum. But if the eardrum has a hole, a perforation, the space will extend into the middle ear. So the average range of normal ear canal volume, so when you have an intact eardrum for children, is 0.2 to 1 cubic centimetre. But when the machine is able to measure through the eardrum and past it into the middle ear, the average volume range is greater than 1 cubic centimetre. And obviously there will be some individual variations here. So you need to know these values, 0.2 to 1 cubic centimetre, in order to interpret the tympanometry results. Here's a middle ear with normal air pressure. The eardrum moves backwards and forwards quite freely. When you do tympanometry on a child with normal middle ear air pressure, the result looks like this, with a peak somewhere in the box. So this is a type A. The peak may also appear at the top or the bottom of the box, depending on how much the eardrum and middle ear moves. Okay, what does this shape indicate? Answer: normal eardrum and middle ear movement. What is the normal volume range of a child's ear canal in cubic centimetres? Answer: 0.2 to 1 cubic centimetres. Okay, now let's say that the child has picked up the germs that cause ear infection. You can see the germs hanging out there in the eustachian tube. Now remember that the walls of the middle ear are lined with moist or wet mucous membrane. The air that flows in and out of the middle ear via the eustachian tube when it's working normally helps to evaporate any excess moisture that comes off that mucous membrane from the middle ear space. But for this child, their eustachian tube has now inflamed in response to those germs and it's blocked up. Air can't get in or leave the middle ear space. However, those mucous membranes that line the ear still need to absorb air to keep functioning. And they continue to do this even though there's no fresh air coming up the eustachian tube. As those mucous membranes absorb the air pressure in the middle ear becomes negative, like a vacuum. The greater the vacuum in the middle ear space, the further the peak on a tympanometry result moves to the left. And that is a type C. If that eustachian tube remains blocked, then moisture that's coming off those mucous membranes actually starts to fill up the middle ear. And that's fluid-filled middle ear, either acute OM or glue ear. And because the middle ear is now filled with fluid, the eardrum can't move freely backwards and forwards anymore. So if you did tympanometry now, what would the trace look like? Would it be peaked or would it be flat? It would be flat, which indicates no movement, and this is a type B. Now, this is actually the point at which ear canal volume becomes relevant. So a type B result indicates no movement in response to the tympanometer. But fluid in the middle ear is not the only condition that causes this, and the other conditions are clinically useful to recognise. So let's look at these. A complete wax blockage of the canal also gives a type B result. Remember, type B means no movement. Wax doesn't move in response to the air being pumped in and out of the ear canal by the tympanometer. So how can you tell the difference between a wax blockage and a fluid-filled middle ear? Well, firstly, you'd probably have a good idea from otoscopy, although not necessarily if you couldn't get a good view. Secondly, this is when you look at the canal. So remember that normal ear canal volume is 0.2 to 1 cubic centimetre for children. And on the graph that's there. But if you have a wax blockage, where is the machine going to measure to? Yes, I know what you're thinking, only up to the wax. So that will be a lower canal volume than normal, so less than 0.2 cubic centimetres. On the graph, that's down there. So, to recap, a type B with low canal volume, less than 0.2, suggests a wax blockage. Type B with normal canal volume, 0.2 to 1 cubic centimetre, suggests a fluid-filled middle ear. And a type B with high canal volume, greater than 1 cubic centimetre, suggests a perforated eardrum. So a question, in a child with grommets, what would a type B high volume result mean? Answer, the grommet was open and ventilating the middle ear well. So that's actually, of course, a good result. So test your knowledge number 3. A child with a lot of wax gets this result. What type is it and what does it indicate? Answer, it's a type B, low volume, and it indicates wax blocking the ear canal. Number 4. Another child with a lot of wax in their ear gets this result. What type is it and what does it indicate? Answer, a type A. It indicates that the wax is actually not blocking the ear canal and that behind the wax, the middle ear is working fine. Number 5. Another child with a lot of wax in their ear gets this result. So what type is this and what does it indicate? Answer, it's a type B high volume and it indicates that the wax is not blocking the ear canal, even though it may look like it is, and behind the wax there's a perforated eardrum. And of course that's something you would want to know about if you didn't already and you were looking at syringing to remove wax. Okay, number 6, a slightly tricky one. You see a child with grommets and you do tympanometry and you get this. What type and what does it indicate? It's a type B high volume. And of course it indicates that the grommet is open and working well. Okay, slightly trickier. You see a child with grommets and you get this. What type is this and what does it indicate? So it's a type B normal and it indicates that the grommet is blocked and that the middle ear is filled up with fluid again. This is the last one. So you see a child who has a cold and you get this one. What type is this and what does it indicate? Answer, type C, although if you apply the minus 150 DAPA that we were talking about earlier, you could also argue that that was a type A. And it's suggesting eustachian tube blockage and negative middle ear air pressure. Now that may go on to become fluid-filled middle ear, or it may return to normal air pressure. Okay, so to recap, you can use tympanometry as a routine part of clinical practice to improve your confidence and your diagnostic accuracy and your treatment and management decisions in relation to ear health. It helps you make referral decisions. For example, it can help you mark the point at which otitis media has lasted for longer than 3 months, and a diagnostic hearing test is now required to measure the impact on hearing as recommended by the otitis media guidelines. It's fast and it's easy, and it gives you information you couldn't have learned from otoscopy alone. The interpretation guide that we talked about earlier is available on the webpage, our webpage. And for assistance with knowing when to refer to us, you can go to our website for our who, when and how to refer to Australian Hearing. For help with interpreting TIMS, or to organise face-to-face training for your staff, you can always talk to your visiting audiologist, whether they're from Australian Hearing or somewhere else. And you've reached the end. If you have a minute, it would be pretty awesome if you could give us some feedback. There's a link to a survey on the webpage. And for any inquiries, please email me or call me on that mobile. And thank you very much for listening. Bye.